Good morning, everyone, and welcome to the Tennessee SHIP Medicare Part D and Annual Enrollment Period Information Session. I'm so glad that we got everyone to come out here and join us this morning. We'll get started in just a few minutes. I just want to remind everyone to mute yourselves, make sure your audio is muted, and to keep your cameras off. This kind of just helps with maintaining the bandwidth so we don't have any issues while we're presenting, as well as write your name in the chat box. That'll also help us make sure we got everyone and we know to send the PowerPoint to the right people afterwards. Today's session will be recorded, so we can post this on our YouTube page, and then we'll also provide you with a link to that afterwards so you can review this at a later time. Please direct any and all questions to the chat box. After we are done presenting today, we'll have a Q&A session, so we will be able to answer all of your questions. And as a reminder, we'll be receiving an email after today's session with all of the PowerPoint today and some more material from us here at SHIP. We should get started in just a moment.
Good morning, everybody. This is Lori Galbraith. We will be getting started in just a few minutes. We'll let everybody get signed in. It'll be just a few minutes. So good morning, everybody. We want to go, I'm going to get started. My name is Lori Galbraith. I am the Tennessee SHIP Program Development and Quality Assurance Coordinator with TCAD. I know I'm seeing some familiar names pop in this morning. I'm really glad you guys decided to join us. And we're going to go over Part D and some of the important things to remember for the annual enrollment period, just to get everybody ready. I know this is really an unprecedented time as far as COVID, and we normally come out to the senior centers and different places and do these presentations in person, But unfortunately, we're not going to be able to do that this year, so we're trying to kind of do a workaround. We're hoping that this works for everybody and we can get some more people involved. You know, there are going to be more sessions of like these that are coming. So please, if you feel like this is an informational session, please promote that within your senior center or your facility, just so we can get this information out to the seniors, because we're really missing that population with them not being able to do one-on-one face-to-face presentations. So we just want to make sure that we're getting this information out to them. So without further ado, I'm going to go ahead and just get started. So everybody knows, of course, Medicare annual enrollment period is October 15th through December 7th. This is the time that seniors use to look at their drug plans. This is one of the most important times because during this time, plans can make changes. They can charge, charge higher rates. They can do, a difference in their deductibles and their costs and their copays and what medicines they cover. So it's always really important for a person to look at their plan. Even if they say, oh, my plan is working for me, I always say, it does not hurt to look. I've actually helped people who said, oh, I'm not going to look at it. Then we ended up looking at it, and they found out that, one or two of their medicines were not going to be covered, and it saved them thousands of dollars just by looking at their drug plan during this time. So it's really, really important. So today we are actually going to use a presentation that was created by Centers for Medicaid Services. So it does give a whole lot of information, so we'll go ahead and get into it. Okay, so next, click in the right place. Okay, so a little bit about SHIP. SHIP is the Tennessee State Health Insurance Assistance Program. We are one of many SHIPs. There is a SHIP in every state. It is a federal program that is grant-based. And we give free Medicare information so that people can make an educated decision on their own. We do not sell anything. We are not salespeople by no means. We do not represent any one plan or program. We just want to make sure that people are getting the education that they need to make their own healthcare decisions. So that is the most important thing. Everything that we do is free, and we are unbiased. Like I said, we're not salespeople. That is important to the SHIP program in every aspect, because we want to make sure that we're not guiding anyone and giving them any one specific plan information. So because you never know what's going to work for one might not work for another. So it's just best to give all of the information to make their own decisions. So we do have a hotline that you can call. It is that 1-877-801-0044. If they call into that hotline statewide, they will reach our call center, which then will get a message and direct their call to the correct area agency that handles the SHIP program. We actually have 9 different regional offices that cover the SHIP program, and that call center kind of fields our calls for us so that we can make sure that we're getting it to their local area so they get that truly localized information. That's so important. We do have a email that is tn.ship@tn.gov. We can actually get those emails in, and just like the call center, we can redirect those to the local centers so that they can get you the information that you need for your area. You can also call 1-800-MEDICARE if you like waiting on the phone. They do have long wait times, unfortunately, and you will be on the phone a while, but sometimes that is the best thing to do, and you know, that's unfortunate, but we do have to refer you there sometimes, but we try to do the best we can with you first. So before, that's our last resort, is to call Medicare. Okay, next. Okay, so Medicare prescription drug coverage. There is several different layers to prescription drug coverage with Medicare. So we have our Part A health coverage, we have Part B drug coverage, and we have Part D drug coverage. That's going to be what we're going to focus on most today, but we will cover a little bit about the Part A and B. The big key is with anything Medicare related is that it is medically necessary. You cannot stress that enough. If it is not a medical necessity, Medicare will not cover it. So that's just a really important part of it. Now, some drug plans, some prescription drugs are given in a healthcare setting, and those are going to be covered either by your Part A or Part B, depending on where you're at. That you'll have to just figure out which one gets where it gets paid for. If there's any medical indication or reason why you need the medication, say for instance, cancer, that will be dependent on whether you get it at home, if you get your treatment at home, if you're taking like an oral chemotherapy medicine, or if you're going into the office to get the medication. It'll really depend on what healthcare setting you get it and what your costs are going to be and who pays for it. So we'll look at that for in just a second. So they do look at immunosuppressives. They do have certain regulations for those medications, and I think we'll go into that a little bit as well. Medicare Advantage plans also have these drug coverages, and if you have a Medicare Advantage plan, you get all of your Medicare covered health care from the plan, including these medications, whether it's Part A, Part B, or Part D. So you're going to have some type of prescription drug coverage with a Medicare Advantage plan. Okay, next. All right, so Part A prescription drug coverage. This is going to be anything inpatient hospital related. So if you're in the hospital, your Part A is going to cover your medication costs. So the key is inpatient. That is the key term right there, because if you are an inpatient, they're going to cover those Part A, your medication. Any medication you have while you're in the hospital, they will cover that. Now, for instance, if you were in the hospital due to an emergency room stay, and they're going to keep you overnight to watch you, if you're in there for observation, your Part A is not going to cover those medications. It may either be your Part B, or it could be your Part D plan, Sometimes they allow you to bring in medications, your own medicines while you're there. Some hospitals do not allow that. So there can be some extra costs if they are giving you your regular medication. So just because you're in a hospital does not mean that Part A is going to cover everything. So you've got to be careful and watch that. The big thing is chemotherapy drugs. If you go into the hospital for observation, they will cover your chemotherapy drugs while you are in the hospital, whether you're observation or not. Also, it covers drugs used in hospice care. So if they are, needing pain medicines and, of course, it's no treatment or anything like that, but just for controlling symptoms, keeping you calm, keeping you relaxed, keeping you comfortable, that's going to be those medications that are covered by that Part A hospice relief. Okay, so Part B drug coverage. These are going to be your outpatient drugs where you are going to a doctor's office, you are in some type of medical facility getting your medications, whether you're going to a doctor to get a infusion, if you're getting an injection. Usually these tend to be really expensive medications. So when you have Part B cover it, you have more of the cost covered. Part D normally does not cover the medicines that fall under the Part B window. So they're going to be the more expensive injectable transfusion type medications. There are some drugs that if they're used at home with a device such as maybe an insulin pump or a nebulizer or something like that, those are going to be covered under your durable medical equipment coverage with Part B. So there are some things that will be done at home. As long as they're used with some type of device, they will be covered, whether it's pain relief or like I said, the insulin pumps, albuterol through a nebulizer, those types of things will be covered. So like the oral cancer drugs, antiemetic drugs, those are also covered under Part B, even though you're taking those at home. Generally, because those medicines tend to be more expensive and they put it under the Part B window of coverage, so you're not having that large out-of-pocket cost getting it through a Part D. They do usually have to get purchased through a DME provider, so that's definitely something to think about. Okay. All right, so Part B immunization coverage. So Part B actually covers some of your vaccines and injectables, like your flu shot, your pneumococcal shot. That is only if you get them in a doctor's office. If you go to a pharmacy, however, to get your vaccines, those are going to be covered under your Part D, as in David. So you will, it'll depend, like I said, it depends on where you're at, when you get the service, on what your costs will be and who will pay for it. So Part D coverage. So Medicare covers your Part D, they're your drugs through your Part D. So always think Part D, D equals drugs. So Medicare drug plans are approved by Medicare. However, they are run by private companies, so it's not a Medicare plan. It's regulated by Medicare, but you have either Cigna or Express Scripts or one of the plans out there that are private. They're run by private companies. They are available to everyone with Medicare, whether it's Part A or Part B. Now, if you're in an Advantage plan, you have to have both Part A and B to get those Advantage plans. But if you have A or B, you can get a standalone prescription drug plan. You do have to have a plan to get drug coverage. There are no separate drug plans outside of Medicare Part D. You do have to get that coverage through the Part D plan, and you could either do it through those standalone prescription drug plans or those Advantage plans that have drug coverage. So you do have to have one of those plans to have that coverage. So standalone drug plans. These ones can, they offer different combinations of coverage. They may cover one medicine where another plan may not cover that medicine and cover a different medicine. They are in control of their formularies and their cost share. Now, they do have to present their costs each year to Medicare to be approved. That's where the Medicare approval, Medicare regulation comes in. Medicare puts those limits on what can be charged and what can't, and they have to approve those. They do have to offer a minimum standard level of coverage. So they can't say, oh, we're not going to cover any chemotherapy medicines, or we're not going to cover any heart medications. They cannot put those limits. They have to have at least one or two medicines in each category so that someone, if they were looking at their plan, could get coverage. If they were, if they were under the plan's window of coverage and they were diagnosed with, God forbid, cancer, they would be able to get some type of medication. Now, it might not be the one that their doctor wants to put them on, and in that case, they can maybe ask for an exception or, get one of the medicines that the plan will cover, and then during annual enrollment, look at the plans that would cover the medication the doctor wants to prescribe. So there are definitely some options there. They can put medications in different tier levels, and we'll go over tier levels in just a few minutes. But tier levels can definitely play a part in what you're going to pay out of pocket. Whether it's a tier 1 generic, which tend to be cheaper, or if they put it in a specialty tier, which tends to be the most expensive. So it's really, truly up to the plans what they put in there. Of course, every year, benefit coverages and cost can change. So that's why it's so important during this time frame to look at your plans and make sure that you're in the correct plan. Because they do notify you, but sometimes mail gets lost in the shuffle and you're getting so much of it in, it's really difficult to keep up with everything, and it gets kind of, put in a drawer somewhere or, in a pile a foot high. So I know I went through my mom and my stepdad's mail last time I was down in Birmingham, and it seemed like I was like, okay, this is junk, this is junk, this is junk, and oh, this one's important. We should have read this a long time ago. But yeah, it happens. So, but they do tell you every year. Okay, so prescription drugs coverage for 2021, just kind of an overview. They have a base premium. It is going to be $30.50 this year. That is the benchmark. So we'll kind of go over it in just a few minutes, but if it's if they're on the low-income subsidy, if they find a plan that's less than $30.50, that will be a $0 plan. That's that number that is important to look at. So if someone gets into the coverage gap or donut hole this year, they are going to pay 25% of brand name and 25% of generic cost. And that's based on the full cost of the medicine. So you are going to be looking at what that retail cost would be. I know a lot of people ask, you know, I thought they said they were doing away with the donut hole. Why is there still an increase? Why am I still seeing expensive medicines during that time? I personally think they used a little bit wrong terminology there. Instead of saying it was going away, they should have said it was closed at that time, and it went from 100% of cost, you know, during that time where people were paying full cost for the medicine during donut hole. The Affordable Care Act actually worked to close it, quote unquote closed, or you know, at least level it off at 25%. So they are considering it closed and not there. So the base premium is $33.06. That's the average cost, and that subsidy is $30.20. Okay, so the Part D monthly premium and the income-related monthly adjustments amount, this is going to affect very few people. We very rarely talk to people that this impacts at all. Fewer than 5% pay a higher premium for their Part D plans. They use the same thresholds to compute the Part B IRMA, which is the increase that they have to pay if they make over a certain amount. This year, it's $87,000. So if you make over $87,000, you will pay a higher amount for there is a chart. Basically, you pay this amount, you'll pay your premium plus those totals to get your total out-of-pocket cost for each month. Like I said, it doesn't affect very many people, but they are looking at your 2018 income, so it may affect someone. Maybe they retired this year and their income has changed this year, but they're looking at income from 2 years ago, so that can be a factor. Now, there's always ways to appeal that. So if you do feel like if you're talking to someone whose income drastically changed and they feel like they can't afford this, you can always appeal to Social Security to see if there's a way to get that lowered or reduced altogether. There's always a way to appeal everything in Medicare. Okay, so the true out-of-pocket cost. So that's going to be what you can expect to pay total out-of-pocket. It includes everything for your co-pays, what the plan pays in your for your medications, and if you get any type of assistance program, what that assistance program is paying. So everything that is paid on your behalf for a medication goes toward this total true out-of-pocket cost. The threshold is $6,550 this year. That means at $6,550, you get to that catastrophic coverage level where your costs will either go to 5% or for the new numbers, they are $3.90 and $9.20 for that catastrophic coverage. So they either pay 5% or that 320 or $3.90 and $9.20. I'm sorry, I'm still learning these numbers. They just changed those on us, so I'm still getting those straight in my head. It'll take, by the time I learn it all, it seems like it'll be changed again. But that is they pick whichever's greatest. So the 5% or those 390 and 920, it's whichever's greatest is what you pay during catastrophic coverage. Something that's new this year, your explanation of benefits from your plan. When you get those, look at them, because it'll actually tell you how close you are to getting to that troop cost, and it'll show you kind of what you've paid to date on those EOBs. So definitely pay attention to those. And also, if you change plans during the year at any time, it will actually transfer with you. So say, for instance, you started out with Cigna, but you decided during the second quarter to change to Express Scripts because one of your medicines weren't covered. You're not going to lose the amounts that you paid while you were on Cigna. It will carry over with you, so you'll actually get to carry that with you. Okay, so the 2021 specialty tiers threshold. This is not going to be the best thing, especially if we have anybody that are on the specialty medications. So in past years, they have allowed people to appeal to the plan to get either a tier reduction where that cost could be a little bit cheaper, or you know, they move it from like a specialty medicine down to a tier 3 or tier 4, where it definitely plays a factor as far as your copay. They are not going to be allowing that this year, so they can exempt a formulary tier from those tier exceptions. So specialty medicines, they can actually put a limit and say, you know, no specialty medicines can be exempt from those tier exceptions. The one good thing is that they are going to put a specialty tier threshold on those costs, and that is going to be $670 for the full cost of a 30-day supply. So that is going to be what they are going to count as the negotiated price for specialty tier threshold, specialty tiers. All right. So what is the annual enrollment period? Our annual enrollment period is the time we all pull out our hair trying to think about what plan we're going to be in next year. You can actually, during the annual enrollment period, you can either join or switch your Medicare prescription drug plan, or you can join or switch your Medicare Advantage plan. Your plan will actually send you, your documents for the year. You can look those over, see what has changed. If maybe deductibles are going up to outrageous, maybe they've put some of your medicines into a specialty tier where it's really expensive for you. You can make changes, any changes you want to. During this time, you could even leave a Medicare Advantage plan and go back to original Medicare. There is so much that you can do during this time. Any changes at all you want to make, you can do. The one thing is with that one, if you leave a Medicare Advantage plan, yes, you can go back to original Medicare and pick up a drug plan. That, however, does not guarantee you a Medigap plan. So that's something to think about if you're thinking of going back to original Medicare. That's a different topic altogether today. We're not going to talk about it much, but I just want to mention you are not given a guaranteed issue if you go back to original Medicare and pick up a drug plan during this time frame for a Medigap. Those Medigap plans, they are set up by individual companies, and they can do medical underwriting and charge you either a higher rate or not cover you, maybe even do a pre-existing condition clause. So there's a lot that can happen. Just keep that in mind if that's a step that, or if you're talking to someone that wants to do that. Make sure that they are aware they will go through medical underwriting. So again, the dates are October 15th through December 7th. Of course, that starts tomorrow. If you are interested in changing your plans, the plans are already on the Medicare website. You just cannot make changes until tomorrow, but you can go ahead and start shopping around now. Please do take the time to look over your plan, look over that annual notice of change that your plan sent to you back in September. I know some plans are making some really great changes. I know just on a personal level, I know my mom's plan, a lot of her copays went down this year. I was really impressed with her plan. You know, the drug costs are still really low, and you know, it's really good to look at those things. Even if it's working for you, always look. Just because, like I said, I have helped people with plans, and we have found that some really expensive medicines weren't going to be covered, and I actually saved someone over $16,000 just doing that one step of checking to make sure, and he would have paid thousands of dollars out of pocket had he not made that decision to sit down with me and look that over. So if you do make changes during October 15th through December 7th, those plans will not start until January the 1st of next year. The plan that you're currently in will last through the end of the year. So it's not going to change right when you make the decision of whatever plan you're going to go with. However, they will be getting your materials in the mail to you. It's going to include your formulary guide, your welcome letter. It's going to have your cards and all of your information in there. So you should get everything to operate your plan starting January 1st as soon as you get that enrollment request to them. Okay, so this is just another graphic that kind of shows that. The enrollment period starts October 15th, continues through November, ends December 7th, and then your new coverage begins January 1. Okay, so how do I compare a plan? So every year, Medicare plans, they can make changes to their costs. Again, they can make changes to their formularies. Everything about their plan they can change. They do send out that annual notice of change in September, and it can come electronically. So if you haven't gotten anything in the mail and you've been asking them to send you things electronically, you may want to check your email, check your spam folder and your junk boxes and make sure it's not there. Because they do send that out. It is required by Medicare, and they get in trouble if they don't. So they are very diligent about sending that to you. So there are some plans that choose to leave Medicare at this time. that happens, and that's definitely something you want to watch out for, because they are supposed to notify you if they decide to leave Medicare, and that gives you an enrollment period to sign up. So you definitely want to pay attention to any mail that comes from a plan that you are associated with. Okay. So this is your time to do your research, do your homework, compare your plans, and then make a decision on what you can do. Every year they send you the new and improved Medicare and You handbook. In the back of the handbook, they will have a list of the plans, whether it's a drug plan or Advantage plan, so that you can see what's going to be available. That gives very generic information. It's not going to be very in depth, but it gives you an idea of, the premiums and what your basic copays will be. So that's a good thing to look at. Read that annual notice of change document when it comes to you. Make sure if you do have the annual notice of change document, they will have an evidence of coverage letter, and it may come separately from the ANOC. Make sure that you're keeping that evidence of coverage letter, because sometimes you never know when you might need that, and you'll have to prove creditable coverage. So you want to make sure that you keep that evidence of coverage in a lockbox, or in a cedar chest, or whatever you're going to do. Keep it in a file so that you can have that if you need it. You could always call SHIP, because we are here to help. That's what we are here for. We can give you the information, go over your options with you, and you can make that decision on what you want to do for the year. If you want to stay where you're at, if you want to make a change. And of course, then if you want to make the change, we could even help you with that process as well. We can enroll you from the Medicare website, just like anybody can. You can enroll yourself in the Medicare from the Medicare website. But how we help, is we can help you go through it and help you enroll if you need that. You can always call 1-800-MEDICARE. Like I said, if you love hanging on the phone and eating up your time on hold, you are more than welcome to call Medicare. Of course, this is their busy season, just as it is ours. Yes, we do get behind during this time, just mainly because of the influx of calls that we are having coming in, as does Medicare. So just know that if you do call them, and even calling us during that time, you may have a little bit of a wait, but we will get back with you as quickly as we possibly can. And of course, with Medicare, they will as well. Now, the Medicare Plan Finder tool on the Medicare.gov site, that is exactly what we use to do our plan comparisons. So it is available to anyone in the public. You can go look at that yourself if you feel comfortable with the internet and with the Medicare site. It is pretty easy to use. It can be kind of a bear to decipher what information you need to be looking at. There's a lot of numbers and a lot of information. We can help with that. So if you do have any questions, if you're looking at it and you've kind of got a question mark over your head, like, oh no, what do I do? Just get in touch with us, because we can at least give you the information to kind of decipher everything and guide you through that part of it. Another thing you will want to look at is the plan's websites. So they send you that annual notice of change. You can always go into the plan website and verify any changes. You can look at their formulary guide for the year if they don't send you one. That way you can know yes, I'm on this medicine, and yes, it's covered, or no, it's not covered, and I need to make a change. So always do your research. These are some great tools to use. And I tout our own horn, especially SHIP, because we are going to try to explain it to you the best that we can, and so that you will understand it, and so you're making that best decision. Okay, so the Medicare and You Handbook, they have reformulated it a little bit this year. I really like some of the things that they have done. I like some of the fonts that they're using. It's a lot cleaner, a lot easier to read. They gave a lot of information for people who are new to Medicare, about important dates and things like that. I think it's a really great copy. It's not going to be very comprehensive as far as what they have on the plan. Like I said, it's very generic information, but it's in the back of the book. I don't know that the early books had the star ratings in there. I know the later books will have the star ratings in there, so I'm not sure. I haven't seen the newest ones yet. I've ordered some new ones, but I don't know if the star ratings are in there yet or not. So they mailed those back in September. If you have not gotten one, you could either reach out to Medicare, or if you would like, you could reach out to your regional office and they can send you one, because they usually order those, and you can actually reach out to your local SHIP office and they can get you one. So it is a great book. Anything you think you could look up or need to look up for Medicare, it's probably in that handbook. Then if not, or if you don't understand it, get in touch with SHIP and we could kind of help you through it. Any other information you can't find. Okay, so the Plan Finder, it's at medicare.gov/plan-compare. It is an awesome tool. It gives you a breakdown of your yearly drug costs, with drug costs and the premium together. It gives you the annual cost, so you'll know what you're going to pay out of pocket for the entire year. So you'll have an idea of what that cost will be. You can look at different pharmacies. You can, different medications. You put all of your medicines in. The pharmacies you want to look at, you could do up to 5 this year, 5 different pharmacies. So you can shop around and see where you're going to get the best deal for your money. You can search anonymously. You do not have to create a login. The login, the one good thing about doing that is if you have a lot of medications, that medication list is already populated based on your claims. So that might be a good reason to create an account, but you do not have to create an account. It'll tell you also if you're qualifying for any special enrollment period. It'll tell you if you get any extra help benefits, so it'll give you the discounted rates if you do. You can learn more about Medicare, and now this year they have actually included a Medigap search tool, so you can actually learn a little bit more about Medigaps and what those possible costs could be for you. So they have definitely done an upgrade to these, to the Plan Finder, and a lot of positive things are coming still. So I'm really excited about using this tool this year. So with the plan website, this is where you are going to find your most comprehensive information about the plans themselves. So if you're specifically looking for something like the AARP plan, going to their plan website, they are going to have a detailed list of what's offered and what's covered, what their costs are going to be. You are not going to be able to find any of that information. Medicare gives you a little bit more than the Medicare and U-Book, but the plans websites themselves are going to have the most comprehensive, or just calling the plans direct. I would be really cautious about calling local representatives, just mainly because you're probably going to be talking to a sales agent, and that plan may or may not be your best bet. So you want to look at, if you want to look at everything, I would go through Plan Finder, and then once you narrow it down a little bit more, go to these plan websites and look at those. Again, they will be sending you that annual notice of change each fall. Just make sure that you are reading that. If you are already in a drug plan, you want to make sure you read that. So if you have any other coverage, like an employer or union or maybe TRICARE or something like that, you want to make sure that you're following up with them to make sure nothing major is going to happen. I know in the past, sometimes a company will drop their retiree coverage or change it to the point where it's not really any good anymore. So you'll definitely want to check in with that and make sure that you are still getting the coverage you need from those plans. So how to join a plan? There are a couple of ways to do that. You can do, yeah, of course, you could always call the plan direct. That is a good way of doing it if you want it done quickly, and or if you're in, if you wait till the last minute and you want to call them, you'll want to call them direct. You could either do it on the plan's website. Usually they'll have like an Enroll Me Now button that you can click. You could also do it on the Medicare.gov site. You could call 1-800-MEDICARE. Any way that you can do it, you could do that. Also, you can call SHIP. We can help you with that. So I know SHIP's number is not on the list here, but SHIP can help enroll you if you need that assistance. When you enroll in a new plan, the plan that you were on will last through December 31st, and then it will be ended. They will disenroll you effective December 31, 2020, and then your new plan will start January 1st. So you don't have to worry about calling the plan, having any those negative conversations. I'm sorry, I'm leaving you guys conversations. So you don't have to worry about that. It's automatically done. You don't have to do it. So this year they have started doing some special enrollment periods for some special conditions. So CMS has actually decided to give a special enrollment period to people who may be going through those employer group health plan elections, and maybe they find that Medicare might be their best option. They can get a special enrollment period during that time now. Or if there's a plan that is going through CMS sanctions, you can actually have a special enrollment period and change to a different plan at that time. And so if there's a government declared or government entity declared disaster or other emergency, and I think a lot of that was brought on by COVID, you can actually enroll. If one plan's not working for you, you could get into another one. You'll have a special enrollment period. Another one, if there is a plan that has been identified by CMS as being a poor performer for the past 3 years, then you can actually get a special enrollment period there. And also, if a plan has been placed in receivership, meaning that they owe CMS or Medicare money, they are not paying their bills, and they have been placed in a receivership, then they can actually have a special enrollment period then as well. So 1-800-Medicare. They are available 24 hours a day, 7 days a week. So if you have waited until December 6th at 11:30 at night to make your decision, you can still call Medicare and get in touch with someone and make changes to your plan, even as late as the last hour. I don't recommend that, but if it happens, if there's something that happens in your life that would prevent you from making the changes before then, this is available to you. They have people that speak in many, many different languages. You can get the information and they can change your plan over the phone immediately. So with a little bit of basic information. So they will be able to do that for you. It is a good tool to use. It just can take a long time. So be prepared to be on the phone for a while. So again, you can call SHIP. There is a lot that we can do to help you through. We can go over the plans with you step by step. We could go over the costs with you, what you can expect to pay. We could get you that information. We do Part D worksheets every year. If you do feel like you would like to get a comparison done by SHIP, you could reach out to us at the 877-801-0044 hotline number, or you can email us and we can send you one of those Part D worksheets to fill out and get back to us. We are more than happy to assist you with this. Everything we do is free. We are going to give you the education to make sure that you are making the right decision for you that year. We can give you a list of what the cost of the plan that you're in versus what your cheapest options are. So, and it may very well be that your plan that you're in is the cheapest option for you, and we will share that information with you as well. So please feel free to reach out to us, and we are happy to assist you with it. Okay, that ends my session. So I have any questions out there? Feel free to either type them into the chat or feel free to unmute yourselves and ask any questions you may have.
Also, Lori, if you want, you can turn off the recording and people can also feel a little bit more comfortable to speak up if they'd like.
Okay, I will do that. Let me get to a point that I can do that. Where is my... Okay, I am not seeing... I do not have a record button.
I don't see it on mine either. So if anything, we can just edit this part out. But we have a question from Evelyn, kind of hypothetical. If the ACA gets repealed, what will happen to the donut hole of 25%? Do you have any insight or any ideas what might happen?
Well, my thought is I do not want to speculate about anything because we do not know, and I don't want to give any, false hope or any, because I have no idea. We would really just have to be kind of on the spot to know that may be an issue. I'm hoping that it doesn't, because that was an amazing addition to the Affordable Care Act. If it goes back to 100%, I just can't imagine what would happen to a lot of our people that we speak to. It is just, that would be terrible. And but I don't want to make any speculations. We are going to hope that this does not happen. Okay, okay, I see the chat. How do you see that the actual prices of drugs per stage on the Medicare website? So I can, sometimes the information comes up and sometimes not. So what, is it a specific type of medicine that you're looking at? They should have on there, I know they have been doing some updates to the page, and sometimes I've been noticing that some of the aspects have been not working or kind of wonky, but then I check it later and then it seems to have fixed itself. I don't know if it's just because of the updates that they've been doing. They've actually been doing quite a bit of updating to the plan finder. So it may just be that you caught them at a transitional period, and that it was that if you keep seeing that issue, reach out to me and let me know so that we can kind of check in with them and see if that is an issue. Because if so, that's definitely something we need to look at with them. But you should be able to see those in the plan details. When you click on the individual plans, you should be able to see, what level at before your deductible, after deductible, during the coverage gap and catastrophic. It should give you a chart on the plan details page of each of the plans. It's not going to be on the comparison page, but if you click on the little button that says plan details, you should be able to see those. Okay, does anyone else have any other questions? Like I said, feel free to unmute yourselves. We and talk to us if you would like. We are here to help. So if you do have any questions, just let us know. Okay, and I think we are at time. We're supposed to be at 11, correct?
We have up until 12 open, but since we don't have any more, since we don't have any more questions currently, I think we're okay to go ahead and wrap up here. Just as a reminder, everyone, if you have any questions or need any more follow-up or anything, feel free to reach out to me. I emailed you all this morning, or you can reach out to the Tennessee SHIP email, which is just tn.ship@tn.gov, and we can get back to you and answer any other questions that you have. But thank you all again for attending today. Thank you, Lori, for giving such a wonderful presentation. And I'll send out a follow-up email shortly thereafter here, and also include the links to sign up for the following sessions. We have about 5 more the next 5 Mondays. Do you have anything else to add, Lori?
No, I don't have anything.
Okay. Okay, perfect. Thank you all again for attending today. We really appreciate it. And this will also be on our YouTube page, so you can refer back to this video later. Thank you, everyone.